News listens live.
And it is a celebration.
With your host, Jon Ramsey.
And welcome into the Wednesday edition of Wave 3 Listens Live. As the holidays come upon us, then we know how important first impressions are. And a lot of that has to do with your smile. That's right. When you smile, people light up. People love to see a confident smile. If you're wearing dentures, that confident smile may not exist. Let's take care of that. We have Freedom Mini Dental Implants with us once again, Dr. Regan Ackerman. Dr. Ackerman, welcome back to the show.
Thank you. Thanks for having me.
There are many reasons why I think Freedom Mini Dental Implants are important and folks should know about them, because the confidence is one thing, but eating the foods that you love,
yes,
being able to get rid of all that nasty glue that comes along with dentures, there's many different reasons, aren't there?
Yes, yeah, and that's one of the biggest things I do is help out those denture wearers. Like you said, they're using gobs of denture glue and they hate it, trying to get them out of using denture glue. Or, we've got Thanksgiving coming up. Mm-hmm. They can't eat what they want to eat, or they're embarrassed about their smile. They don't go to the family function because they're embarrassed that their dentures might fall out or things like that. So with the mini dental implants, essentially it's just a smaller diameter implant, a lot less invasive, a lot less costly than the other implants, but we can snap that denture in, get rid of the glue, eat the things you want to eat. And then obviously there's a lot more things we can do with these mini implants, replace single teeth, get rid of partials, and all kinds of things like that.
Yeah, and the holidays are a time for joy, and I think a lot of folks out there, if you do wear dentures, yeah, you're embarrassed. Perhaps you avoid taking pictures with your family. It really does affect you in so many different ways, and you talk about foods that you love you're not able to enjoy. A lot of those fibrous foods have nutrients in them as well, and you're missing that too,
Definitely.
Right?
Celery, carrots, all those
steak
fruits
with
and veggies.
Iron. And
yes, turkey.
Yes.
All those things that people want to chew and eat again. I've seen so many patients that we were able to do the mini dental implants on, and now they can go out to eat and order whatever they want off the menu, and they don't have to be self-conscious about it or excuse themselves from the table after they eat to go, put their denture glue back in and things like that. So these mini dental implants are very valuable and just help people in so many ways.
Okay, before we show the before and afters of Bruce, before we get to that, real quickly, if you could, there's a couple of methods here.
Yes.
And if you could show them the models, how it works and why it's less expensive and why it's really less invasive. There's hardly really much to it.
No
really.
Surgery, no stitches, no incisions, anything like that. So this is kind of the most common thing we do. This is what we call the snap-in denture. So this model, imagine this is your mouth without any teeth. And these little kind of silver posts you see are the mini implants. Now, when I place these mini implants, I'm just using a little local anesthetic, getting the gum numb. I don't make an incision. I don't make any stitches. It is not major surgery. But then these are little titanium screws, and we place those. And the same day I place these implants, you'll leave with your denture snapped onto these implants. And then no more denture glue, a lot more confidence and security to know that your denture is going to stay in. That is the biggest advantage of these mini dental implants, getting rid of the denture glue. And like I said, usually about half the cost of the surgical implants. So it makes it a lot more affordable. And because these implants are smaller diameter, I'm able to help out so many patients that were told they weren't a candidate for implants or didn't have enough bone or had to have, sinus lifts or bone grafts. We'll show the other model later, but it shows you I don't have to have a lot of bone. I just need some bone to place these implants.
And it's very rare that you get someone who is not a candidate. It's very
pretty rare.
Yeah.
I mean, I'd say about 95% of my patients that come in for a consult, I'm able to offer them, an option with the mini dental implant.
So if you've been told no in the past, things have changed. Now, the other method, I want you to show that real quickly, because this is like having your third set of teeth. Baby teeth, permanent teeth. This set works. I mean, this is really, essentially, it's like having your own teeth.
Yes.
Because this model... Now, this is just no plastic, right?
No more denture. Get rid of the denture altogether. And this is definitely the nicest thing we do. So same thing as far as placing the implants. We just put some more implants in, but no incisions, no surgery. But as you can see, like you're saying, it's not a denture. It is just the teeth. And these teeth are going to cement on to these implants permanently. And then this stays in your mouth. You brush it like you normally brush. We give you a little water irrigator to keep it clean. But then you don't have anything on the roof of your mouth anymore. You can taste your food better. You don't have that bulkiness of the denture. Like you said, this is like getting your third set of teeth back. It's permanent. It's definitely the nicest thing we do. And you can just throw that denture away and not have to worry about that.
Yeah, you've got a collection of old dentures.
Yes.
And I would think that people are probably pretty happy to get rid of those, aren't they?
Definitely. It's very rewarding, you know, especially when we do these permanent ones, because, you know, people can, you know, eat whatever they want to eat and they don't have to worry about anything. It's fantastic.
571-5263. If you or a loved one have thought, you know, I don't know if I'm a candidate. Things have changed now. It's a lot more advanced, and they're experts. Freedom Mini Dental Implants. Okay, let's take a look at Bruce. Bruce is a patient. Proof's in the pudding. Before and after pictures. Here we go. Okay, tell us about Bruce.
So Bruce, awesome guy, came to me, you know, struggling with his smile and his teeth and just tired of, you know, everything was failing, and he needed his smile back, and he wanted to eat again and chew again. So we actually did the permanent teeth for Bruce on the top, and he ended up with a snap-in denture on the bottom. So he's kind of a combination of both. And you can see in his after picture, there he is, smiling away. And, you know, Bruce is not a man of many words, but when I saw him back after I did his case, you know, I'm like, what can you eat? And he's like, I can eat anything I want, basically. So
that smile looks much more genuine.
Yes, yeah. So, but yeah, so we did the permanent teeth on the top for him and the lower snap-in denture, and he's just, you know, ecstatic. He's got his smile back. He can eat again, chew again. You know, doesn't have to worry about his teeth anymore, and no more trips to the dentist and just spending, you know, cycling through money trying to fix what he had.
You know what I find amazing is, and I'm sure you notice this as well, it probably doesn't get old to you either, is that they look quite a bit younger after you get really pretty teeth in, and I mean, the youth factor comes back as well.
It does. It takes years off of you for sure, and the confidence factor. I mean, people are so much more confident. I know you've heard me tell people of, you know, I had patients that told me, like, everyone, you know, thought I was mean or depressed, or, you know, because I never smiled and I was embarrassed. And I had one patient now, she's like, you know, people are like, you're so much happier. We love your smile. And just that, you know, getting someone's smile back can increase their confidence.
No question about it. I agree with you. And we've all known people, friends of ours, maybe family members, who they talk like this. They're embarrassed about their teeth.
And they
there's
may
no
not
reason.
talk about it. People struggle in silence, for sure, because a lot of people are embarrassed to talk about it. So.
And to me, with Freedom Mini Dental Implants here, there's no real downside. I've researched this. I've talked to you a number of shows. We've been doing this for a while now, and it's like, okay, less costly, less invasive. You're going to, the downtime,
the recovery time is a lot less.
Everything is it's less, and it's just as permanent, just as safe. So why wouldn't you? And I think you probably hear that comment a lot. I wish I'd have done this earlier.
Yes, we hear that a lot. Yeah, and a lot of people, you know, if you've been wearing dentures for years, you don't know this option is out there. So, and that's another thing. Our office, it's a free consultation. All you have to do is call, make an appointment. You know, it's a free consultation and a free X-ray, and I'll, you know, do an exam and go over with you what your options are and what the costs are. Because, like I said, it's not new technology. It's been around for 10+ years. But if you haven't been to a dentist in a while, or your dentist may not know about, you know, the advances in this technology, that this option is out there for you.
Yeah, or if you've been told you're not a candidate, or perhaps you thought, well, I don't want to go through all of that, all the surgery and seeing the orthodontist, seeing the surgeon, and back and forth. This is really simplified, and it works. I think an apt comparison is, it used to be when you had an appendectomy. If you had your appendix taken out, then it was all this, you know, scar and this long process and downtime, and now it's done with a laser. And that's kind of the advances.
Laser version of implants,
for
sure. Yeah, it's a lot less invasive.
Can you promise me this, Dr. Ackerman? Can I get a smile like yours?
Yes. I'll do my best.
You've got a great smile. You've been told that.
Thank you. Yeah. I had braces for a long time.
Well, it worked, and thanks to Mom out there. Didn't you say Mom's watching today?
My mom is watching today, so thanks for my braces, Mom. It paid off.
Thank you, Rosemary. Appreciate that. All right, we'll take a little bit of a break here, and again, we're opening up the phone lines, 571-5263. If you'd like to talk to Regan Ackerman, Dr. Regan Ackerman, and ask her about your case, your loved one, she'll be happy to field your questions. We'll be right back. It is the Wednesday edition of Wave 3 Listens Live.
Your mornings are full of firsts, and Wave 3 News Sunrise is first on breaking news.
It is our top story here this morning on Sunrise.
Here's what we know right now.
LMPD looking into exactly what happened here this morning.
Right now in that neighborhood.
They've been all over social media this morning.
First to get you out the door.
This is what you got to deal with. This is when we see the rain chances really ramping up.
And keep you on time.
6 o'clock hour, and as you're about to grab the keys and head out the door, here's the latest so far.
Wake up to what's new with Wave 3 News Sunrise. Your first move in the morning.
At U of L Health, we are world-renowned visionaries, academic and community physicians, and medical researchers joining together to provide groundbreaking treatments and innovative care. Now, our world-class medical expertise is part of nearly 250 physician practices, 1,000 providers, 5 hospitals, and 4 medical centers, all dedicated to making the impossible possible.
Welcome back. Wave 3 Listens Live. Dr. Regan Ackerman. And you know, Freedom Mini Dental Implants. Throw away the glue, get rid of the dentures. And you know what? It's time to, quit putting it on the back burner. No more procrastinating. Take care of your teeth. Have a confident smile. Eat the foods that you love. So many reasons. All right. 571-5263. I don't have an IFB, so I don't know who's calling. But if there is a phone call, I'm sure we will be aware here. Okay, Dr. Ackerman, when you meet with clients, what usually do you find is their number one question? What is some of the pushback that you receive?
I mean, mainly they want to know, if they can eat again, and they not wear the denture glue. The denture glue is the biggest thing, or get the denture off the roof of their mouth. So a lot of times that's where the permanent teeth come in, or doing the snap-in denture, we can kind of trim the roof of the mouth out. But besides cost, they just want to know,
Sure.
Number one question, is it going to hurt? And things like that. I always say, we're not doing any incisions or stitches. This is the least invasive way you could have a mini, an implant in general. So, and this kind of shows you, I don't know if we can show this model.
Yeah, we can take a look at that. Now, this is the old way compared to the new way, right?
Yes, yeah. So this is a great model, because a lot of times when I show patients this model, it, makes so much sense to them. So the little hole, that is the hole that I make when I place an implant, versus the conventional standard size implant. It is a much bigger hole. So yes, it is, more downtime, more of a surgery.
And you need more bone.
And you need more bone. So you can see how much bone you have to have for the conventional standard implant. The mini implant, like I said, it's just a smaller diameter implant. It's made out of the same thing.
Just
it's
as
titanium,
stable.
Just as strong. But as you can see, I can help patients out that, don't have as much bone, or were told they had to have bone grafting or sinus lifts. Things like that, because I do not have to have a lot of bone, I have to have some bone. So I see so many patients that were told they had no other options, and I'm able to give them an option with the mini dental implants.
And I know that everyone's different, but in regard to cost, you say it's about a third less, is that about right?
It's a third, sometimes
more.
a half of the
Sometimes
cost.
half.
Yeah, because we have patients coming in with treatment plans for the standard size implants, and bone grafts and sinus lifts, and a lot of times I'm able to give them a treatment plan that's, a third or about half of the cost.
And consultation is absolutely free.
Consultation's free. All they have to do is call, set up an appointment, and no charge for the x-ray.
Okay, and I do think there's a lot to be said for the aesthetic, for being able to smile and be confident about it, but there's also a lot to be said for eating the foods that you love, being able to go to a restaurant, not worried about your dentures either falling out or becoming loose, not having to go to the bathroom to get more glue. Right. We've all seen that happen with loved ones. Do you consider now, Dr. Ackerman, with the way your field has really evolved, do you consider dentures are kind of archaic?
They are, a regular denture, honestly, I hope no one should have to wear just a regular denture, because it's glue, it moves around, and you're right, with the advances in technology that we have these days and with the mini implants, you should have a denture that snaps in, or get the permanent teeth, or you're right, those dentures are kind of old school. We're trying to get away from those for sure. And we have a lot of people that come in, they may just be missing one tooth or a couple teeth and a partial, and we can help those people out too. You don't have to be missing all your teeth or in a denture for us to help you out with the mini dental implants. So
I would think the manufacturers of the denture glue, they don't like you guys.
They do not like me. No, we get rid of that. So, but yeah, I can show this model, which shows, a lot of people They always have a good story if they're missing their front tooth, a sports injury, you know, anything like that. But a lot of people have to wear a flipper, which is like a partial. But I'm able to just replace one tooth with a mini dental implant. So same thing, place the implant, no incisions, no stitches. We'll place that implant, and then we're able to have just one tooth, and that will cement on to the implant, and it's permanently cemented on to that implant. So you get rid of that partial or whatever you were wearing to replace that tooth. And it doesn't have to be just one tooth. It can be, you know, 2 or 3 teeth. I see a lot of patients that are missing, I call them your big chewers in the back, your molars, and they just want something to chew with again. So we're able to place the implants with the, you know, just no incisions or surgery, and then we cement on the teeth to the implants, and then that's permanently cemented in there, okay? So, you know, no incisions, no stitches, and you get rid of that partial and that flipper. It's a great option for people for, you know, just missing 2 to 3 teeth, or if you're missing that one tooth, which always has a good story, a sports injury or a bar fight or something like that. I see a lot of people, I help them out missing that front tooth. There's some people that are born without a front tooth. I saw, you know, a 18-year-old the other day. I was able to help replace a tooth. He'd been wearing this retainer for like 4 years, and I was able to get him out of that retainer and give him a permanent tooth there. So we can help people any age too, you know, 18 to 90-year-olds. I see them all, that's for sure.
Yep.
So this is a great service for people.
A lot to be said for a confident smile come the holiday season. You want to participate, you want to be in pictures. 571-5263. If you have a question for Dr. Ackerman, we welcome your calls. Okay, now as far as location for people who want to go in for that free consultation, of course call for an appointment, but where are you located?
So we are on Dixie Hwy, pretty much across from Valley High School. So I will say we're a small little office, kind of tucked behind another building. So just look for us, though. We're across from Valley High School, closer to the Gene Snyder on the Dixie Highway. But we're totally worth the drive. I know we see a lot of people, you know, Mount Washington or E-Town, you know, besides surrounding areas. But it's definitely worth the drive to come see us on Dixie Highway.
No question about it. Again, like I said, if you've been apprehensive before, maybe you were told you're not a candidate. You are now with Freedom Mini Dental Implants. Dorothy joins us now. She's been nice enough to call. Dorothy, thanks for watching. You have a question for Dr. Ackerman?
Yes, I have. Good afternoon.
Good afternoon.
Okay. I'm calling because I have upper dentures, and they keep breaking, and my gums are real sore, so I wonder if I'm a candidate.
Yeah, so I see a lot of people in your situation. They've gone through constant denture repairs, you know, teeth are breaking off or the denture's breaking, and the implants can certainly help stabilize that denture to help prevent those breaks. And I also make my dentures kind of with it's called a fiber reinforcement, and it makes that denture a lot stronger to help prevent breaks and things like that. And that would be really important in your case to have. So yeah, I definitely, you know, welcome you to come to the office and let me take a look and help you with your struggles, so maybe you don't have to worry about your denture breaking all the time, because I know that's very frustrating. So
thank you for the call. 571-5263. The snap-in dentures, obviously you can take those in and out, but for the permanent teeth, how do you clean those? Just like you do your regular teeth?
Yep. So you're going to brush them just like you brush your regular teeth, but then we also give you a water pick, like a water flosser. I call it kind of like a power washer for your mouth. But that helps just keep that edge clean, you know, because you still got to keep things clean for sure and healthy, but you're going to brush them like you normally brush, use some mouth rinse, and we give you a water pick to keep that clean.
All right.
Yeah.
Once again, if you'd like to give us a call, if you have a question, 571-5263. We're going to take a little break. We'll come back. More with Dr. Ackerman. Freedom Mini Dental Implants on Wave 3 Listens Live.
At Campbellsville University in Louisville, we see your calling and we can help you find it. With flexible and affordable classes on campus and online, as well as a diverse selection of degrees and programs, you can find your calling at Campbellsville University in Louisville.
Relax, recline, and save during the ultimate indoor living event this weekend at Watson's. Motion sofas from $5.99 and dual-powered reclining sofas not $14.99, now only $7.99. Plus, interest-free financing till 2021.
When your loved one is injured, you're faced with the sudden responsibility of caring for them. A parent, a spouse, a sibling, and sometimes, unfortunately, your child. Looking after them has become your reality. It became my reality after my brother Tim's injury. If the roles were reversed, I know that Tim would have fought for me just like I did for him. Who will you call in your time of need? Who will you hire to fight for your loved one? Morgan & Morgan, forthepeople.com.
Welcome back. Before we go back to the phones, I want to make another point here. Actually, you make the point, Dr. Ackerman. We were talking during the commercial break about periodontal disease, and it doesn't only affect your mouth because this gets into your blood system, right?
It affects your systemic oral health, and we always say the mouth is the gateway to the rest of your body. So when your mouth is unhealthy, it certainly can make, the rest of your body unhealthy, especially heart health. That's the biggest connection they found with periodontal disease and heart health. But I've seen a lot of people, too, that think because they had periodontal disease and all that bone loss, they don't think they're a candidate for the implants. But they still can be a candidate for the implants, especially the mini dental implants. So don't let that, discourage you. If you had periodontal disease or bone loss, you're still a candidate. And to another point, if, a lot of people with, medical histories and things like that, these are so minimally invasive. I don't have to take people off of blood thinners or change medications or anything like that. And I know that's a lot of people worry about that as well.
Yeah, it's a big concern. So if you do have a challenge or a question, 571-5263, as Shirley joins us. Shirley, thank you for watching. Welcome in. Oh, Carol, I'm sorry. Carol, welcome in.
Thank you.
Hi, Carol.
Hi, how are you?
Good.
Good. I have two teeth on the top, and they've turned black. And I was wondering what would cause that to happen.
Sometimes it could be a cavity. I don't know, if you've had it checked recently, but, cavities can do that. I have a lot of patients with older crowns that have silver, and sometimes the gums recede and that silver gets exposed, and they think it's their tooth when it's actually kind of part of their crown. But there's a lot of different reasons. You may see that darkness, could be stain, severe stain, smoking or what your diet is. Obviously, if you come in for a consultation, I can take a look and see if it's something that, you can save those teeth, or if they do need to be removed, and if we need to replace them with the mini dental implants. But that's a good question.
And the consultation is absolutely free. Let's grab another call and talk to Cheyenne. Cheyenne, good afternoon. Welcome in.
Thank you.
Hi.
Hi. My sister has the regular dental implants. And she's gone through probably 3 pair by now.
Okay.
They fall out. She's got like 1 pair now that's got 4 teeth missing in it. And she goes out to this place, I'm not going to name names.
Right.
But they're cheap made. And I need her to come see you.
I would love for her to come see me. I do see people that have the surgical, what you're talking about, the standard size implants. And I'm able to make dentures for them usually too, with the new attachments, if that's what you're talking about, that, her denture teeth or, keep breaking and things like that. Or sometimes I even add mini dental implants around the, the conventional implants to stabilize things even more. So, it doesn't continue to break and things like that. But yeah, that's a frustrating situation when you've probably gone through lots of surgery and money and still in that situation. But you're right. Please have her call me and set up a consultation and see how I can help her. I'd love to. So good question.
All right, let's grab another call here. Richard joins us now. Richard, thank you for watching and good afternoon. Welcome in. Go ahead, Richard. Don't listen to the TV, Richard. Listen to the phone. Hello, Richard. Yes, go ahead.
I was just wondering, is the flap on the denture on the top?
Can you repeat that question one more time for me?
I was just wondering, on the denture implant?
Yes.
Is the flap on the top of the mouth?
On the
on the top one?
The roof of the mouth. Yeah, so a lot of times when we place the mini implants, I can trim back the dentures to where it doesn't have to cover the roof of the mouth as much, especially for gaggers. So if I could just trim it back a little bit, it makes a huge difference for gaggers. So with the snap-in denture, we can kind of take it off the roof of the mouth a little bit for you, so you can taste your food a little bit better and, you know, not have that gaggy reflex from wearing a denture. That's a great question. I'm glad you brought that up because I don't think I mentioned that earlier.
Thank you for the call. Let's try to squeeze one more in and talk to Karen. Karen, welcome in. You have a question?
Yes, I did. I was wondering, I got teeth that's breaking, and I was wondering, do you have to go to another dentist to get the teeth pulled, or would you do it there?
So we do refer to get the teeth taken out to another dentist or an oral surgeon. And usually when you have a tooth taken out, and you're never not going to be without a tooth, but we do ask for about 4 months of healing, but we'll make, you know, something for you that you'll wear. But we do, you know, you will go to another dentist for the extractions. That's a good question. I always tell people if they have somebody they're comfortable with, or I work in connection with some fantastic oral surgeons that, you know, work well, and we refer you to them. So good question.
Yeah, so a Christmas present to yourself or to someone who wears dentures. Throw away those dentures. Get rid of the glue. Eat the foods that you love. Feel confident in holiday pictures. It all can happen at Freedom Mini Dental Implants, located on Dixie Hwy. Once again, I can't stress this enough. Consultation is free, so have a look-see, right?
Yes, no charge. Like I said, it's worth, you know, just coming in and let me take a look and see what your options are. Go over cost. You know, it doesn't hurt to make a phone call and come see me.
That's right, because I want all those crunchy cookies. I want to eat some holiday nuts.
Thanksgiving and Christmas.
There we go.
For sure.
All the good stuff. There we go. So enjoy holidays to the fullest with Freedom Mini Dental Implants. We'll take a quick break here. Come back. We'll tie up the show. Hey, guess what? I've got rodeo tickets to give away. Would you like to go to the rodeo? Hang in there with us. Get ready by the phone. Wave 3 listens live.
I'm Amy McGrath, and I approve this message. Everything that's wrong in Washington had to start someplace. How did it come to this? That even within our own families, we can't talk to each other about the leaders of our country anymore without anger and blame. Well, it started with this man who was elected a lifetime ago and who has turned Washington into something we all despise, where budgets and healthcare and the Supreme Court are held hostage, a place where ideals go to die. I'm running for Senate because it shouldn't be like this. I learned as a daughter, a mom, a Marine, and a fighter pilot that the mission can never be forgotten. There is a path to resetting our country's moral compass, and we can become, once again, the moral and economic leader of a world in disarray. But to do that, we have to win this.
The North American Championship Rodeo is in town Thursday through Saturday at Freedom Hall, 7:30. You're going to see bareback riding, bull riding, saddle bronc riding, steer wrestling, team roping. It's all there. Country and Western, you're going to love it. It's the real deal, man. These are tough, real cowboys. If you'd like to win tickets, be caller number 3 at 888-800-9283. You'll win 4 free tickets, or you can get your tickets at Ticketmaster.com. All right, Dr. Ackerman, all the pushbacks, there's none. It's all positive, right?
It really is. I know people always, you know, what's the downfall of this? And I haven't found one, and that's why I love these mini dental implants. Less invasive, less costly, you know, less recovery time. It checks all the boxes.
Checks all the boxes,
yes.
That's right.
Yes.
So again, Freedom Mini Dental Implants, and the consultation again is absolutely free. Give them a call today, and then visit Dr. Ackerman on Dixie Hwy. Have a great day. We'll see you tomorrow on Wave 3 Listens Live.